In this video, Dr. Furze will share with you the details of comprehensive nasal airway surgery, what it is, the benefits, and how to prepare.
Hi, I'm Dr. Furze, and I'm here to help you understand comprehensive nasal airway surgery so that you will know what to expect and to ensure that you experience the best results. When I perform these surgeries, I am dedicated to improving your nasal form and function so that you can breathe better, look better, and live better. I firmly believe that each of my patients deserve to be able to breathe freely and improve their lives by reducing or eliminating breathing issues. I will work closely with you to understand your breathing challenges and any aesthetic desires that you may have. We will work together to create a comprehensive plan to accomplish your goals. Comprehensive nasal airway surgery resolves nasal breathing obstructions. I can perform these surgeries at the same time as rhinoplasty or revision rhinoplasty. This gives you the benefit of a single surgery to address both your functional breathing and aesthetic goals. The three main areas that typically cause nasal obstruction are the nasal septum, the inferior nasal turbinates, and the nasal valves. Most people have more than one area contributing to their nasal blockage. Comprehensive nasal airway surgery can resolve a multitude of problems, including difficulty breathing, runny nose, postnasal drip, snoring, chronic sinusitis, headaches, frequent nosebleeds, sleep disordered breathing, and facial pain. I created the Ultrastructure procedure to correct nasal septal issues. By reshaping and reconstructing the septum, I am able to preserve the original septal cartilage. This ensures the long-term strength and integrity of your nose. This technique can be used in both primary and revision surgeries. I take a comprehensive approach to reducing the size of the inferior nasal turbinates. The turbinates are cylindrically shaped structures that run along the bottom part of the nasal cavity. With my approach, you will achieve long-lasting breathing improvement through the nose. This surgery repairs areas just inside the nostril and sides of the nose to open the airways for better breathing. We will tailor a nasal valve approach to specifically meet your needs. Your first appointment will be a telemedicine appointment where we will get to know each other. We will discuss your functional nasal issues, any aesthetic concerns, and your medical and surgical history. You will visit our office for your second appointment. We will take a CT scan of your face, nose, and sinuses using our in-house CT scanner. This will allow us to diagnose any nasal obstructions, sinus, or facial abnormalities. If you have external deformities or decide to undergo cosmetic nasal or facial surgery at the same time as your sinus surgery, high-definition photographs will also be taken at this visit. Your third appointment will be held via telemedicine so that we can review your CT images with you to show you abnormalities that require correction. We will also walk you through your potential surgery at this visit. Your fourth appointment will be a preoperative visit in our office. A nasal evaluation will be conducted to confirm the CT findings, and we will review your surgical plan one more time. We will also order prescriptions for postoperative pain medications and any needed antibiotics. After this appointment, you are ready to go to surgery. To ensure positive long-term outcomes for my patients, I assess each person's unique situation to determine the best course of action to meet their functional needs and/or aesthetic goals. Utilizing my unique surgical techniques, you gain many benefits over traditional nasal surgeries. Your results should last a lifetime compared to traditional septoplasty, where obstructive deformity can progress years after the procedure. My techniques help avoid issues such as nasal collapse, breathing obstructions, and weakening of the nasal structure. Your tests typically need to be done 30 days before surgery. 2 weeks prior to surgery, stop taking ibuprofen and aspirin-based medications in order to avoid unnecessary bleeding or complications. Only take medication and supplements that have been approved by me. Begin sleeping face up for a week or two before your procedure. Wear clothing that is easy to take on and off, such as a button-up shirt so that you do not have to slip anything over your nose and face. Your surgery will be performed under general anesthesia at an accredited surgical facility in Orange County. Typically, nasal airway surgeries are performed in 1 to 3 hours, although it could be longer depending on the functional breathing issues inside your nose, and if you are also getting a rhinoplasty surgery. On the day of surgery, you will check into your assigned surgery center. At that time, you may be required to pay any copays or coinsurance if there is an insurance component, and a cosmetic charge for the aesthetic portion of your procedure. The nurse will review your medical history, such as any medication allergies, and will also start your IV. I will visit you and answer any last-minute questions. Our anesthesiologist will speak with you and then begin the anesthetic process by giving you some pre-operative medication. Your anesthesiologist will escort you to the operating room and then to recovery when your surgery is finished. During your recovery time, your nurse will make sure you're doing well, remove your IV, and help you get dressed. Since nasal airway surgery is done on an outpatient basis, you will return home after surgery. You will not be able to drive after surgery. We will call your driver with an estimated pickup time for you. I'm Dr. Furze, and I would like to thank you for your interest in our practice. If you have any nasal, sinus, rhinoplasty, or facial plastic surgery concerns, give us a call today so that we can help you breathe better, look better, and live better.